Welcome back to Picking Up the Pieces. I am Joanna Seidel and the host of this podcast. In our last episode, we talked about growing up in two homes and how we can help children thrive after divorce. Today, we are shifting gears, but we are still staying close to the heart of what we do as therapists, understanding how people think, feel, and connect. In this episode, we are diving into the topic of ADHD and how we see these clients in therapy. We will talk about ADHD and how it shows up across all stages of life, in children, teens, and adults, and how it can deeply impact marriages and family life. This is a really special episode because I am joined by two amazing therapists from our team who work with clients who have ADHD. They bring so much energy, experience, compassion, and perspective to this topic. We have Regina, who started her career as a teacher and now works as a therapist. She has her master's of education and brings an incredible understanding of how ADHD shows up in children and families. And we have Melissa, who has done so much work with both children and adults with ADHD, helping people make sense of their experiencing, building self-understanding, and creating meaningful change in their lives. So let's start with this topic. Let's just start. The term ADHD has been thrown out so many times. I mean, everybody says to me, "Oh, I have ADHD. Oh, sorry, I didn't get this task done because I have ADHD. Or don't mind my ADHD." But I can't, everyone can't have ADHD. That's impossible. Can you guys share with me what ADHD is and help define it?
Sure. I think, ADHD shows up very differently in different people. It shows up differently in men, in women, in early adulthood. So, there's a lot of misconception around ADHD and what it actually looks like. And it will look different for everybody. Typically, what happens is that the brain doesn't make enough dopamine. And dopamine helps with focus, emotion, regulating the actual nervous system. It's also important to note that ADHD is very highly genetic. So it does run in families. And that also gives us an idea like when I talk to a client, I want to know what the history is with the family. Oftentimes, it gives me another clue to know that a mother, a father, even a grandparent that has ADHD, and that helps us. So what it typically looks like can be very different for everybody. It can look like distraction. It can look like someone not being able to organize themselves. It can look as though they're not paying attention, but it's not that they're not trying to pay attention. It's just that they can't pay attention. The focus is off many times. And in ADHD clients, their emotional regulation is usually goes really, really high when it comes to, if there's an argument, their feelings get even bigger than they would normally get for somebody who doesn't have ADHD. It looks like they are not struggling sometimes, and it might appear that they're lazy or that they can't do it. And it's not that they can't do it or don't want to do it. It's just something in their brain is not allowing them to do it. And there is definitely through, therapy and different types of therapies help with this. We also sometimes, although we're not physicians and we can't diagnose, but I do oftentimes recommend that if I see these things, that they go and see their family doctor or their pediatrician to find out, what is actually going on with them. And sometimes we want to look at, is there anything else medical underlying all these things? Because it might look like they have it, and sometimes they don't, but sometimes they do.
So, and Regina, I'm going to come to you now. Why do so many people now have ADHD? Is it because it's more well known and we're better at identifying it and diagnosing it? Or do you think there's an overdiagnosis? Like, tell me why so many people these days have ADHD.
So, just like Melissa stated, it really does show up a lot at school. Teachers are one of the first people to notice it and to flag parents, caregivers about what ADHD looks like at school, how it affects the kids in the classroom, both academically and socially. So, yes, it is a lot more well known. I mean, now with social media, also, there is so much information. We're indoctrinated with information about ADHD and how it shows up. I feel sometimes when I was working as a teacher, it was really showing up in the classroom as a comical thing almost, where I have ADHD and therefore I didn't do my homework, or I just can't focus, or so for a lot of kids, it does show up in a way where they don't necessarily have all the um, diagnosable symptoms, but it does show up in that way where I just have it. So yes, just like Melissa stated, it is important for parents, caregivers to go on to their family doctor, psychologist sometimes, to get a formal diagnosis. So the word is not just thrown out.
Right. Like we really don't want to throw out that word. What I really want to know is, there are kids really struggling out there with ADHD. I've seen it in our clinic. I've seen it across children and adults. And like tell me what that looks like. Like how do you know if you have a child who is truly and really struggling with symptoms of ADHD?
I think that, again, we don't always know. And I think that's why it's so important. Like a lot of things that go on in homes or go on with the child, underneath what you might see in school or what we might see in the clinic, it's not always ADHD. It might seem it does. ADHD can mimic other diagnoses. It can be where, when a child is going through a divorce situation, or maybe they're concerned about, something in their social group, it can show up as symptoms of ADHD. That's why it's really, really important to go to see a medical practitioner and have the proper testing to find out, and there is, assessments that when it's a child that a teacher will do, a parent will do, and to really figure out and to rule out, just like they do in medical cases, to rule out whether it is or it isn't. There is, there are times that doctors will prescribe medication for it. I'd love to give one, quick example about, I have a client that was seeming like there's ADHD. And they went to, I referred them to see a doctor, and the parents were very against it. They didn't want the child to necessarily go on medication and wouldn't necessarily, accept the fact that this could be what the child has. It turned out that not only did the child have this, but their grades in grade 11, where the parents were concerned and tried everything. So the child ended up taking medication along with therapy and tools and strategies to help them in school. That child, within 4 months, really improved their marks. Their self-regulation improved. And like I say, it's a combination sometimes of medication and therapy that really helps the child.
I just want to talk to you about something because I've never heard ADHD described the way you just did. What you told me is that sometimes it can be mistaken because a child is going through a situation. And we often talk about situational depression. Like you don't really have general depression, it's not going to last a long time. It's it's because of a situation like you're getting a divorce or you experienced a loss. But what you're saying is you actually see ADHD symptoms come up that way, like it's situational. Can you help us all understand that? Because we never talk about this.
Yes. I think, when kids are going through particular situations, just like you said, situational depression or even situational anxiety, all of a sudden a parent will say to me, if I can give you, again, like I think about an example of parents that are living in two separate homes, and the child is generally pretty calm, does pretty well at school, and all of a sudden, the teacher will send a note or have a quick conversation with the parent to say, you know what, this child is typically, does their homework, hands things in on time, focuses in class, and all of a sudden, they're not able to focus. They're not handing in what they're supposed to do. They're not listening in class. And that very often can those are symptoms of ADHD. But because of what the child is going through in that, could be in that week, it could be in that month, it could be because I just had a client where they moved homes, and all of a sudden the mom wrote to me and said, this is what I'm seeing. And I can say to myself, wow, somebody else might say, wow, that sounds like ADHD. And it does sound like ADHD. But when you dig further and you have the child come in, you see that it is not actual ADHD. It is situational stuff that's happening in the home, or even in the car ride. They might be seeing something different, because the way that they're reacting to the situation at hand is very much because they are having trouble regulating themselves. There's a lot of situations where children have trouble regulating themselves that has nothing to do with ADHD.
So that is really interesting. And I'm really glad that you shared that, because I think what you're also saying to us is probably before being concerned about ADHD, or before a child says, oh, I for sure have ADHD, we really need to see some symptoms over a certain period of time play out. So, not really jumping into that, but letting things play out. And I have a really important question for Regina is, if you do have ADHD, does it last forever?
So it's interesting. I mean, if it is a situation where it could be something like a situational episode where the kid is going through a divorce, their parents are going through a difficult time, they're moving homes, they're maybe moving countries. I mean, yes, I'm sure the symptoms will dissipate at times with the right tools and strategies and the right support from parents, caregivers, teachers alike. But could it go away necessarily on its own without helping that child implement those tools? I'm not necessarily sure that will really be seen so vividly. Just like you mentioned situational depression. So if a child will be depressed about something, or a situation is occurring where he or she is depressed, that could dissipate sometimes on its own if the situation, gets better or easier for that child, easier to navigate, for instance. But here I think it's really, really important for the child's caregivers to implement the tools and to help them with that emotional regulation issue they may be facing, that disorganization they may be facing.
So I want to stay on that topic, because you work with so many children and so many parents, and I get such wonderful feedback about the child therapy you do when you are working with children who have ADHD. But I want to hear, what do you tell the parents? How do you help the parents navigate this situation and help their child cope with ADHD?
So that's exactly what I do in the majority of the work I do. Not just here in therapy, when I was a teacher as well. Helping the parents and caregivers navigate the children is fundamental to helping them be successful as a child and therefore in their future.
So give me like 5 strategies you tell parents.
Structure, time management, calm, helping them know some children get overstimulated. ADHD really shows up in kids when the situation is an overstimulated situation. So that calmness, knowing your child, and both at school and at home, knowing that they may need those 5 minutes to regulate, to calm down, having those calm corners. I have calm corners in my office when I work with kids a lot of the times.
What are calm corners?
Good question. Where I have a little tent set up in the room where I see where their emotions are heightened, and we'll sit down together in the calm corner, and they will sit in that little tent or a little cubicle that I've created out of a little sheet. And we have those fidget toys or a coloring book where they're able to regulate their emotions and come back to the environment that we're in.
I love that. How come you never invited me into your calm corner? Because I need to come
You are
every single
welcome.
day into your calm corner. I want to stay on that topic.
Sure.
So you talked about structure. Tell us, what does structure look like for a child, and how do parents who work every day and who are in the grind of everything implement that structure?
Well, it's interesting. Not only are we in the grind, but lots of kids are in extracurricular activities. They're in high performing sports, dance, hockey, baseball. And that structure is fundamental to these kids thriving, especially when they are overstimulated. These kids' brains are overstimulated all the time. And that structure is important in knowing that we do this at this time. When they come home, they do this. When they come back from school, they do X, Y, and Z. Dinner is at a certain time. Breakfast is at a certain time. And it really helps them regulate what's happening next so that they don't necessarily get that overstimulation.
So, what I hear from parents so much is that during the full school day, these children are really getting emotionally and physically fatigued because of all the energy that they need to devote to their day. So, even though the parents want them in extracurriculars and to do all these things, their cup is full. Like their energy is depleted by midday, never mind the end of the day. So, what do you tell parents with that?
So, two things I'm going to respond with that is not only is their cup full naturally because our lives are so busy and we throw kids into all these things all day because we seem to think that they need to be stimulated and always busy. I think boredom is important. I think it's important for parents and teachers to teach kids that it's okay to be bored because their brains, people, individuals, both children and adults, their brains are overstimulated. Their brains, not only are they tired from their busy, busy days, but their also brains are overstimulated with information shooting back and forth, back and forth. What do I do now? What do I do next? Where do I go? They're disorganized a lot of the time. Of course, not everybody, but classically, they're disorganized. So just like we treat different ailments in different ways, we treat individuals with ADHD differently. So not every child needs a stimulation after school, like an after school program. The parents and caregivers need to know their own children. Some kids thrive on having an activity 4 days a week or 5 days a week. Others need that break because when they're in school from 8:30 to 3:30 or whatever the day is like, and then run out to an activity and then are expected at the the upper grades to do their homework and complete those tasks, it's impossible.
Mm-hmm.
So I think it's important, A, to know your child, and B, to know how you hone in on what's best for this child and their needs.
So you really have to determine the best interest of each child, and each child
Definitely.
the parenting has to be tailored uniquely to them, and especially with children who have ADHD. And what's so interesting is when I learned about parenting, I'm going to give everybody a tip that when I learned about parenting, and I took a parenting course a long time ago, I learned about the 80-20 rule. And I learned that, 80% of the time in parenting, you do the right thing, you respond to your children effectively, you're attentive, you're loving, you're nurturing, you're compassionate. But 20% of the time, it's a bit of a circus and you have some leeway there to lose your cool. Don't lose your cool too much, not do the right thing, kind of ignore your kid, not respond to them. There is that 80-20 rule. But what I did hear that when you have a child who has special needs or who has ADHD, it's not an 80-20 rule. It is literally a 90 to 95% rule because you need to be on it and responding appropriately all the time. And Melissa, I want to hear from you because one of the things you've actually told me before is that when you have a child or you're a therapist with a child who has ADHD or special needs, you have to be incredibly patient. And I know that you're incredibly patient. So I want to hear about that tool that you offer.
Yeah. So I do want to just add to what Regina said, and or just to say in general, it's really important to understand that when you have a child with ADHD or you're working with a child with ADHD, you're working with a child that has ADHD. So to her point, that every child needs to have a different plan, whether it's medication and therapy, whether it's therapy alone, whether it's there has to be a real particular strategy for that child. And the routine part of things for children in general, we know, and there's been many studies that show when children have routine, ADHD or non-ADHD, it is very important. With kids who have ADHD, the routine becomes even more imperative. And I also want to get to your question But I just want to say that it's not only helping the child regulate, which we call co-regulation, it's also the ability to regulate yourself when your child is having a meltdown or unraveling, even when we want to raise our voice. And I know here we're all parents, and I know all the parents out there watching, we all raise our voice. I don't think there's one parent that can say we never yell or we never raise our voice. And that's very, very common.
Tell me what co-regulation is.
So co-regulation is when a child is having a meltdown or is in a heightened emotional state, that we want to try, number one, to stay as calm as we can, to stay as patient as we can. And even though we're repeating necessarily instructions over and over, we want to literally, depending on the age of the child, we want to get down to the child's their position where they are, and talk to them in a calm way. And when I talk about co-regulation, it's doing things with them to help them calm down. So it might look like breathing. Sometimes I call it bunny breathing, where it's like quick breaths in and then a long breath out. It might be literally saying nothing to them, just patting their back, or just looking at them and saying, okay, let's come here and sit on the couch together and just relax. So it's really just doing with them what you would do as a parent to almost relax yourself.
So I'm going to share with you the perfect storm, because one thing I know about you is you have the skills to do that because you don't have ADHD. But what happens when you have a parent who has ADHD and a child who has ADHD? So you're not able to regulate yourself as well because you're struggling with ADHD, and yet you need that 90-20 rule to apply with your child. So, Regina, I know that you can answer that. If you could answer that for us, that would be great.
I mean, just like we were saying before, when we implement those strategies and those tools, it is imperative for the parents and caregivers and teachers and anyone taking care of these kids to know how to handle them. It's important for them to learn the skills and tools themselves.
You
As
teach them, right? Like that's
I do.
something you do in our
I
office.
do lots of parenting tips, tricks. I've had parents sit in my quiet corner full well disclosing that they themselves have ADHD. They are totally unraveled when their kids are in, I call it in my office, crisis mode. How do we mitigate crisis mode? So myself, the adult, the parent, the caregiver, whoever is in with the child, we sit in a quiet corner, we play with the slime, we play with Play-Doh, we think of things to regulate. And just like parenting is lots of lead by example, here too, we lead by example. When the child sees the parent able to regulate their own emotions, they're able to replicate that and hopefully transfer that into their own lives.
But they're not always in your quiet corner. And
They're
you
not.
said something really important, is that when the child is at their
Crisis
stressful
mode.
moment or in crisis mode, the parents unravel. And then that's the perfect storm. So how do we help these parents when not unravel, be able to co-regulate and be able to soothe their child and bring them back to a place of baseline where they're regulated, even when they have ADHD and their symptoms are, kind of becoming apparent in the moment?
So I advise for everybody, not even necessarily people just with ADHD, take a moment, take a breath. Stop what you're doing, walk away for a minute if it's safe to leave the child for a minute alone or for a minute out of the room. Walk out, compose yourself. And that not only helps you as the adult in the room regulate, but it helps the child see this is what we do when it's too much, when we're boiling. When I talk to parents a lot of the time, we talk about a pot that boils. When you see that pot overboil on the stove, aside from being super annoying that it's a big mess, I sort of feel like it's similar to kids. It becomes a big mess. Everything becomes a mess, similar to when a pot of pasta overboils. So taking a moment, sitting down, you're right, we don't all have quiet corners, but we are able to stop And a lot of times in my office, I have a big stop sign and I show parents the same way. When I work with adults with ADHD, I show them the stop sign and they generally chuckle at me and look and say, well, this is funny, but it works.
Okay.
And yeah, we have to stop. We have to know ourselves.
Okay. So some parenting tips that we're discussing when parents have children with ADHD is that 9 out of 10, 9.5 of 10, or the 90-20 rule, where 90% you have to do your job in responding to your kids in a way that makes them feel calm and supported. I'm hearing about routine. I'm hearing about consistency. I'm hearing about structure. I'm hearing about don't overprogram them. When their cup is too full, they may need some downtime. They may need some boredom in their lives. I'm hearing lots of good parenting tips that parents can apply to their children who are struggling with ADHD. I'm going to shift gears right now and I'm going to tell you a story. So, I have a good friend and I have known her husband for a very long time. And she had shared with me, we were deep in a discussion, and she's like, no matter what we do in our family, my husband is always late. It could be my child's first birthday party. It could be a sibling's wedding. It could be the most important family event, but he is always late because he's always doing a task that doesn't get complete. I mean, he's always preoccupied. Can you help us understand how that comes up in relationships? So that, I mean, and I said to that friend, is it possible that he has ADHD? And a light bulb went off in her head. And she's like, wow, because he's not hyper. He's not yelling at her. He's just chronically late and very invested in the tasks that he's doing, yet they don't get complete. So, Melissa, can you help explain that?
Yeah, I want to also note that ADHD, which the acronym is Attention Deficit Hyperactivity Disorder. I just want to clear a sort of another sort of misconception that not everyone who has ADHD is hyperactive. It can look very much like focus or inattention, and it can have quite a big impact on marriage or on partnership.
I think that's a common myth about ADHD, that when you have a child who's ADHD, they're hyperactive, means they're jumping on chairs, they're bouncing off the walls. These are things we have thought about that would describe ADHD. But actually, what I've seen with ADHD children is that they can become very quiet and anxious and distressed and isolated.
Right. And that brings us to another point, that it does show up very differently in boys and girls. Boys often do have more of the hyperactivity. In girls, it does show up more in isolation and in not necessarily being able to have their feelings come out in the same way as boys. So that's another thing to really keep in mind for parents. So it can look very differently in different children.
Can you clarify that a bit more? Like, can you tell me a little bit, like, let's go through. What does it look like in males and what does it look like in females?
So I can, again, it really depends on the child. You can have a male that has the hyperactivity, the inattentiveness, not being able to focus, heightened emotions, staring into space when you think they're not paying attention to you, and they're really not paying. Often it's very interesting. Often children describe to me, and young adults describe to me, that I say to them, "What does it feel like in your body?" And they say, "Well, when my teacher's talking to me, it's like I'm missing every third word. I'm literally like, I kind of get it, but when I go to do my homework, I don't really know what to do." And that's a really, sometimes, for parents, part of going back a little bit, it's really important for parents to, and a lot, I think as therapists, we all do this, is that we want to really understand what the child is feeling. Like, what does it feel like? What are you actually, like, what is going through your body? What is going through your mind? And I think part of that co-regulating is to, especially if a parent has ADHD themselves, is to say, like, I'm feeling like this when that happens. What do you feel like? So getting curious for these kids, because not everybody feels the same way. I have a child that I'm actually working with now who the parents are telling me, like, very good grades. The teachers all of a sudden, like, she's not, she doesn't seem to be looking at me as much. She doesn't seem to be, she seems to be fidgeting a lot. And I spoke to that child and again, really getting curious, like, what does that feel for you? And it's amazing what comes out that it might appear a certain way, but what's really underneath it all, we can get a lot deeper. Like there's typical symptoms that happen, but when you start to talk to each individual child, you hear a lot of different things.
I love that question. What does it feel like in your body? What does it feel like in your brain? Right? What does it feel like? And that is wonderful questions to ask children. And it's so, you said be curious, but what I'm going to tell you is that most people have a difficult time being curious. Most adults are actually impatient, right? They get frustrated. They may even become punitive. So, that's kind of the reaction sometimes that children are getting when they have undiagnosed ADHD, for example, and parents know how to manage it.
And it's the same thing, because going back to your question about the partnership and the marriage, it's the same thing with a partner that doesn't have ADHD living with and cohabitating with a partner that does. And oftentimes that non-ADHD parent feels like they're ignored, feels like, in your case with your friend and her husband, where the husband is not on purpose, not paying attention, not focusing, being late, not seeming to finish tasks. That is, again, those are symptoms of ADHD. And where the other partner will feel like, they don't care about me, or it's not important enough to be on time, or, so all these things can be going through that, or maybe I need to carry more of the load, and there builds up resentment that they're not doing enough. And it's not that they don't want to do it or that they're lazy. It's that their brain their brain is wired differently and has trouble starting or being on time or doing those things.
I hear it a lot. I hear it's very difficult to be married to somebody who has ADHD. And I hear all different reasons for it. Some related to not being able to complete tasks, some related to chronic lateness. Another symptom that I hear that comes across a lot in being married to someone who has ADHD or being in a relationship with someone who has ADHD is that they have very intense emotions. They feel very intensely. And what happens? That leads to a lot of arguments and a lot of conflict. So, can you help us with that and understand that?
Yeah, you're right. It leads to a lot of conflict, a lot of long-term resentment, and then they start to feel like the communication is breaking down because they don't understand. So part of it is, being able to educate both parents. I actually had a couple last night that, I was giving them some education on, they were letting me know what's happening in their marriage, in their household, and I was thinking they haven't been necessarily diagnosed at this point, but I was asking a lot of questions on what does that look like for you and what does that feel like for the non-ADHD parent. And a lot of times it feels like, they don't care or they're distracted when I'm talking to them, or, I feel like I'm doing so much more than this person is doing. So it's educating, sort of finding out what that looks like and what that means, and then educating the other parent to say sometimes we need to regulate ourselves and be more patient with that person.
Another problem that I often hear with people who have a partner with ADHD is that there's an uneven division of labor. They have uneven, tasks to complete within the house because the partner with ADHD can't complete them all the time. So that leads to a lot of arguments. It leads to criticism to the person who has ADHD, and the other partner in the marriage feeling overwhelmed with the burden of having to take all the household tasks or more of the parenting tasks. Can you tell me a little bit about that?
Yeah, so that's true. I mean, parents who the partner who feels like they have to do more and constantly do more, even though they might be reminding the other person. And oftentimes it's like I hear, I keep reminding her, I keep reminding him to, like, take the garbage out, or, um, you know, empty the dishwasher. And even though the chores have sort of been divided between them, when it actually comes to the actionable steps of doing it, oftentimes it's not done. And it's not because they don't want to, it's because their brain works differently and they have trouble starting. And to them, it's just not important. It's almost like with ADHD, it's like it's like a right now, or if it's not right now, it's later. It's now or it's later. So if
Or
you don't,
doesn't the task become super important, like making a sandwich, right? And instead of just whipping a sandwich together, it becomes super important. They're kind of focused. They're hyper
that's
focused of
exactly.
everything.
So oftentimes, a very good point. Oftentimes in ADHD, which I don't know that we've actually covered to this point, is that people with ADHD often hyper focus on what they enjoy and what they love to do. And when it's something else that's not that important. So for example, great example, which I think most families go through, is that my kid is hyper focused on, let's say, video games. Now, all kids, to be fair, if I could focused on video games, but it could be a video game. It could be playing the guitar. It could be one particular thing that they love. But when it comes to chores or things that they don't care so much about, it's that thought is fleeting. Even though their mom might say, you know what, you need to, remember it's your turn to take out the garbage, or your turn to do the dishwasher, or your turn to do this. Oftentimes they, if it's not done now, it's never done because they
Mm.
won't remember. So there's a lot of times we have to give kids and even adults, tools to manage that. Meaning, like, one of the things I use very often is having them in front of me put reminders into their phone, and
Mm.
literally
Mhm.
marking, okay, at 9 o'clock, I need to do this. And they mark, at 9 o'clock, what happens? Before I go to bed, I need to make sure that all the doors are checked,
Mhm.
whatever it is. And sometimes, the cell phone might work for people. And sometimes I have people carry around a small pad with them, writing down my to-do list today.
I think that's a really good point that you make, that actually we should all know that they hyper focus on activities that they love and they can't focus on activities or tasks that are more unpleasant. And so, Regina, maybe you can talk a little bit more about hyper focus, because I think that's a symptom that we misunderstand a lot.
Definitely. And I think we also, because we focus so much on the hyperactivity part of it, it is something that we don't recognize as much as really important for those people. If making a sandwich, to your example, is really, really important for that individual, be it a kid or an adult, they don't think about anything else. And what happens at school in a relationship is, if they're focused on making the sandwich, they've forgotten that they have laundry to do, the dishwasher to unpack, pack something for tomorrow. And I think it's really important in talking about relationship to shift from blame to teamwork, to know what are my strengths and what are your strengths in the relationship. And as couples, we tend to know what our strengths tend to be. And if I know that my partner's strength happens to be doing the kitchen work or doing the laundry, not blaming them for not completing the task. But like to Melissa's point, it is important to remind them, put it in your phone. It's important to pack the bags the night before for the kids. Please put it in your phone at 9 o'clock at night so that it's done. And then it alleviates a lot of the conflict that could arise with couples.
Okay. And do you see that a lot? Like ADHD, when one partner has it in a relationship and how it affects the other partner? Do you see that in your practice a lot?
All the time. Not only that, I chuckle to myself at the point where you mentioned it, because a lot of times both parents could have it. Both parents could have it and the teacher could have it.
Okay.
And it sometimes becomes a perfect storm, because how do we manage our own internal conflicts as well as managing the child? And I think education is key here. I think knowing our own strengths, because if one parent, for instance, is somebody who tends to hyperfixate on something, and another one is more hyperactive, for instance, and the child's hyperactive, well, how do we balance all of that to create more calm in the home?
So I don't see that a lot. It's a really interesting topic that you're raising. What happens when you live in a family where both parents have ADHD? How do they manage?
So, I mean, the word chaos came to mind. And I think managing that chaos, managing that conflict, managing the struggles in the home by knowing what we all need to succeed. I know for myself personally, I put a lot of reminders in my phone. Otherwise, I have way too many things on the go to remember all that I have to do. My partner, for instance, does not need to do that. He tends to know what he has to do and get it done. And when I see this in my own practice, putting reminders in the phone, using fidget toys. Sometimes with individuals with that hyperactivity, they tend to need something to have in their hand to fidget, a little stone to ground them, tools to help them regulate their own emotions so that the chaos doesn't show up in their lives or is mitigated as much as possible.
So, what I am hearing a lot of is that if you have the right tools that are tailored to you specifically, then yeah, if you have ADHD, you can function optimally.
100%. We see
Tell
that
me
all the
about that.
time. We see that all the time. I saw that at school when I was working as a teacher for over a decade. I specifically worked with kids with ADHD in resource rooms. Um, I saw them thrive. I saw them become, at this point now, I've seen them graduate high school and get into prominent universities, on their way to medical school, law school, lots of different careers. I see it in the home where parents are able to live in a world where there is an issue, but when we know the tools and the skills and we have the strategies, we are able to work it out.
Right. Well, that's really an important advice for everybody, that no matter what you're going through, and if ADHD is that thing that you're going through, know that you can function optimally. Know that if you get the right education, the right support, the right tools, you can lead a very, very full and rewarding and loving life. And what I know about people with ADHD is because they feel intensely, they love intensely, and they make wonderful parents with that very intense love, and wonderful partners, and they're devoted and they're dedicated. So I want to hear more about the strengths of people and who are living with ADHD, and how they function and how they love and how they parent. Can you share some of that with me?
So, to your point, they're creative, they're passionate, they're energetic. They think out of the box. Individuals with ADHD tend to think out of the box. They're able to come up with ideas that are absolutely phenomenal. I really feel that these are the people that are at the forefront of all the new ideas, of all the new skills that we all replicate afterwards because they really do just think out of the box.
I also think because they feel so intensely, they're easier to connect with, right? You can have that kind of connection because they feel. And so, Melissa, I want you to piggyback on that topic and talk about more of the strengths of ADHD, and how children and adults can continue to lead optimal, functional, loving, amazing lives, even if they have that as part of them.
So, oftentimes you're right. Like we talk about all the things that are difficult, right? And there are so many strengths and so many positives to kids and adults who have ADHD. You know, I think that again, like what Regina said, they're extremely from my perspective and from my experience, they're extremely creative. When, we can look at where they hyper focus on something that might not be so great for them when they're younger. The actual hyper focus when a child gets older into their teen years and into their young adulthood and beyond that, what they end up loving and focusing on oftentimes becomes a career for them. And oftentimes that is what makes them so successful. We look at some of these, we even look at some of like the Elon Musks, the people that a lot of these very successful people actually have ADHD and other stuff going on that we don't, well, we know about some of them and some of them we don't know. And that is really, where these people can oftentimes go deeper into sort of what they love. And I often find, that these people are very, very intelligent, very smart, and the thinking out of the box gives them a very different perspective than somebody's brain that doesn't work like that.
And I think you're absolutely right. ADHD, like, first of all, it doesn't mean you're intelligent or not intelligent. It has, nothing to do with that. And people with ADHD can be very, very intelligent. And I love what you just shared, is that if you have that ability to hyper focus and as you grow older, and that's what's expected of you. You're expected to choose a career, choose a passion, and put everything into it. And ADHD people, or people who have ADHD, can do that more naturally.
And, and to that point, I think, I had a child come to me and say, my parents have been talking to me about becoming a lawyer. And even though I did well in my law courses, I did well in this, and it's kind of what I thought I would do. What I really have been thinking about, and through doing therapy with me, I'm realizing that I want to follow my passion. And I think I want to go into, I think it was music. And I think I want to maybe follow business music, or something to do with engineering and music. And I said, I think that's a wonderful idea, because that is something that that person is passionate about. And he said to me, I really think I could be successful at that. And I looked at him and I said, absolutely. That is something that is really important that we take, with younger kids, I say, this is actually your superpower. And I think it's really important that we as therapists and we as parents empower and encourage our kids to do what makes them feel good.
I love that. So people with ADHD, when they really hone into their skills, it becomes their superpower and they're able to perform in such a focused way. So what we heard today is that there is ADHD out there. It's real. And there are people who truly and deeply struggle with it. It should not be a term that is thrown around loosely, but it is a very serious term. And if you have ADHD, embrace it. Get the right tools, get the right psychoeducation to help you manage it. We have two wonderful, excellent therapists over here that we spoke to today who gave us so many tools about what you can do as individuals, what you can do as children, and what you can do as parents to manage your ADHD symptoms. But we also heard the wonderful lives with wonderful strengths that people who are struggling with ADHD can lead. So I want to take some time and thank each of you really deeply for coming here today and speaking about such an important topic. There's so much more we need to know. We haven't even really touched on it. And I want to bring you back in a different date to talk about more about this really important topic. But I thank you both for being here. I think this was amazing. I think it was informative. And thank you again.